All right, in the interest of time, we're going to go ahead and get started today. So thanks to each of you for joining us on creating an equitable, effective, and efficient homelessness system, leveraging the FY24 and 25 COC program competition NOFO webinar. Today, I have joining us Josh Johnson is a senior technical assistant specialist at the Alliance, along with Kay Mosier McDivitt, aka Kay Mosier McHousing. We have myself, Mary Frances Kenyon. I use she, her pronouns. I'm the Vice President of Training and Technical Assistance at the Alliance. This next guy needs no introduction. He's everyone's favorite Chief Policy Officer, Steve Berg with the Alliance. And surprise, we've got a surprise guest. One of our federal partners is here with us today, Erica Jones Haskins from the U.S. Interagency Council on Homelessness. So there are some takeaways that we want each of you to walk away from today's webinar with. We're going to spend a little bit of time talking about alignment with HUD priorities and some of the key changes from this year's COC program NOFO. We'll hear a little bit from our federal partners at USICH about the federal strategic plan to prevent and end homelessness, all in. We're going to talk about how we can move the NOFO from transactional to really transformational for our systems and being strategic. So Kay Mosier McHousing is going to talk through some of those strategic considerations to end homelessness. And then I will wrap us up by talking a little bit about less about the NOFO and more about what communities can do during their year off. Josh Johnson is going to close us out with some resources and wrap up before we move in, before we close out. Before we get to the meat and potatoes of today's webinar, the Alliance does have some statements for participation. The chat should be largely disabled, so unfortunately you're not going to be able to communicate with anyone via chat today outside of hosts and panelists. That is by intention. It gets very busy and sometimes is a distraction for our panelists. But you do have the opportunity to chat us directly, and there's also a Q&A for any questions that you might have. So our statements for participation really help us make sure that we have the opportunity to hear from diverse voices, across the range of our speakers, attendees, and guests. This is at conferences and webinars. We welcome everyone. We do have a zero tolerance policy for any form of discrimination or abusive behavior. We're really committed to making sure that everyone feels safe and respected as participants in Alliance-sponsored activities. You, by virtue of attending today, are acknowledging that any form of discrimination, violence, or abusive behavior might result in removal from this webinar. And if you are experiencing or witnessing any during this training, please notify the hosts and panelists so that we can remedy the situation. Last but not least, we really are striving to create a more diverse, inclusive, accepting, and safe space for everyone. Few things for housekeeping. You all are all muted as attendees. Please use the Q&A function. You can also chat the hosts and panelists, as I just mentioned. You won't be able to do much information and idea sharing today on the webinar, but we do want to let you all know we are not HUD. So you may hear things from Alliance specifically, from the Alliance specific panelists today. We're not going to be able to answer all of the questions that you might have, but we have put up the COC NOFO email address if you have those technical questions that really need guidance from HUD. Right there on the screen. It'll also be towards the end as we wrap up. And of course, don't forget to stay connected with the COC program competition page. That link is down there. One of the biggest questions we get on these webinars is, will this be available after today? Yes, our webinars are recorded and we try to get them posted as timely as possible and make sure that they go out in our newsletters. So first up, again, this guy needs no introduction. I am going to turn it over to Steve Berg, who's going to talk about aligning with HUD priorities and some of the key changes in the FY 2024-2025 NOFO. Steve?
All right, thank you, Mary Frances. Thank you for everybody who's on the webinar today. Of course, everybody's in the middle of pouring through all the NOFO materials that HUD has sent out. People who do this, of course, are looking for the specifics of what scores, how many points you get for doing what, and all those details. But it's also important to remember that those details, those scores, are there to help HUD promote certain policies that HUD believes, and we believe at the Alliance, mean less homelessness. So I'm going to go through some of these policies today and a few other details of the NOFO. So first of all, this slide talks about some of the policies that HUD is trying to promote with this NOFO. Some of them are things that have been in the NOFO for years, and that first group that continues prioritizing. Of course, racial equity is a very important priority for HUD. It's very important to actually making progress on homelessness. We know many communities around the country in their work on homelessness have made this a local priority for themselves and adopted all kinds of processes to achieve progress in this area. So that will continue and continues to be an important part of the NOFO. Reducing unsheltered homelessness and reducing criminalization. This continues to be a priority. It's a priority for leaders all over the country. It's a priority for us. We don't want to see unsheltered homelessness, but it's been going up, and it's important to try to use this NOFO to promote policies that'll reduce it. Including people with lived experience in the planning process continues to be a priority. That, again, is something many people in this field have worked on over the last several years and will continue to be important. Partnerships with other groups, with housing groups, with healthcare groups, with other services, organizations, and programs. The Continuum of Care program is a very important piece of any community's work on homelessness, but it's not going to be the whole thing. I mean, there's just not enough money there to pay for everything that is needed to really end homelessness. So it continues to be a strong policy to work with other kinds of programs, particularly the ones listed here, to make sure healthcare in all its different forms is available, to make sure that more housing is available, services help with people to get jobs, help with casework for vulnerable people. These are all important things that the Continuum of Care can be part of, but also there are much larger funding sources that are more specialized in those areas, and so it's important to have those partnerships be part of this work. Now, HUD has re-emphasized these are priorities that they've had in the past, but the way we read this NOFO, they're emphasizing them more this year. One is improving system performance, getting the outcomes that the homeless programs need, keeping people safe, getting people quickly back into housing. Those are the sort of system performance measures that the NOFO is emphasizing. Placing an emphasis on anti-discrimination against LGBTQ plus individuals. This again has been something that's been a priority that HUD has named in recent years, but HUD is stressing this more, and it's important to make sure that people who have high rates of homelessness, and that includes people in this category, that there's specific work done to make sure that people can use these programs and get the benefits of them. And then again, supporting local engagement to increase the housing stock. We all know from the way that homelessness keeps going up, despite the the great work that people in this field are doing, that the ongoing and continuing problem of affordable housing and lack of affordable housing is driving this problem. And it's important for people who are in the homelessness assistance field to be part of local efforts to make sure there's enough housing, and the housing is the kind of housing that people can use in order to avoid becoming homeless in the first place, or to quickly become housed if they experience homelessness. Okay, next slide. So there's a new policy that is articulated in the actual NOFO this time, which is building an effective workforce. Of course, this is something we at the Alliance have been working on for a number of years. We did surveys a number of years ago as when COVID first sort of hit. It became very clear that people working in this field were having a hard time. Pay wasn't enough, high turnover. Our surveys have found that these challenges were a problem then and have continued to be a problem now. So HUD is making this a policy priority and looking for communities to use the funding in the NOFO to make sure that this is addressed. We'll talk a little bit more about that later on, but there have been new policies that Congress put in place that have moved things in this direction, and HUD is being very clear that this is an ongoing issue that they would like to see dealt with. Okay, next slide, please. So this is a handy slide where all the different policy priorities that HUD has articulated are all on one slide, so you can see them all right there. The first two there we haven't talked about yet, and those are sort of the two overarching ones, ending homelessness for everyone. Often that requires a complex set of strategies to work with different programs and different organizations that just deal with one population or another. But that is the ability to use these funds to end homelessness for everyone is definitely continues to be a leading policy for HUD. And then the second one is using the housing first approach, which housing first has of course been in the news a little bit. There are certain people who are trying to discredit federal spending on homelessness programs by saying that housing first is bad, but HUD is very clear that at least what they mean by housing first, which is a housing-centric, systematic approach to ensure that everyone gets access to housing, or as many people as the money can support get access for housing, along with the other kinds of help that they need, but that housing is the answer to homelessness. And then the rest of the priorities there are the ones that I already talked about. Again, it's important to have these policies, partly, because if you include these policies in your application, you probably get a better score. That's a good thing. But it's also important, these policies are out there to help people improve their homeless systems. This is, besides being something that'll help you get a good score, this is a recipe for having the most effective possible homelessness system. And so that's why it's out there, and it's also out there to help you build support for these priorities with others in your community. The fact that these priorities will help your community get funding from HUD through the Continuum of Care process is a way to get people in your community on your side with doing what they have to do to make these policies something that your community does. Okay, next slide, please. I got a couple quick little things to talk about here that are new this year. some key changes, 2-year NOFO cycle. It's a little bit complicated because HUD has put out a 2-year NOFO, but Congress has only given them money for the first year so far. So there will be some things that many communities will have to do a year from now to access the second part of this. But most of the work will be encompassed in this NOFO. If there are other things that you have to do a year from now, it'll be much, much easier because of the 2-year NOFO. So there's a lot more from HUD about that in the actual NOFO documentation. I think we'll be talking about that a little bit more on the on this webinar. Next slide, please. Okay, and then a couple other more detailed changes is for the people who are into the details here. The tier 1 tier is set at 90% of the renewal demand. That's a little change, and people, I won't go into all the implications of that, but you can definitely look that up on the HUD's website. And then the cost of living adjustment. This is another thing that Congress has done because they heard from you about the issues with the workforce. That HUD has not only made that a policy priority, but they've put into place money that they specifically got from Congress to deal with this problem. So the annual renewal demand figures that you're getting for your continuum should include adjustments in for the cost of living, and you can see how those were figured out again for the real data people here. Definitely more questions about that. Definitely talk to your people from HUD, or get in touch with us later. Okay, that's it. Let me finish my part there, and I think Erica is next on the list here. So let me turn it over to her. Erica Jones-Haskins from the U.S. Interagency Council on Homelessness.
Thank you, Steve. Much appreciated. Good afternoon, everyone. Thank you so much to NAEH for inviting us to be a part of this. I know that everyone knows the importance of collaboration, but it's really great as a federal partner when we can have such a strong national partner to have us in this forum to support the work and support your communities. In case you didn't know, my name is Erica Jones-Haskins. I am the Director of Policy Initiatives here at the U.S. Interagency Council on Homelessness. For those of you who don't know what the U.S. Interagency Council on Homelessness is, we are the federal agency responsible for coordinating across 19 member agencies to support coordination at a federal level around homelessness. And probably most important and relevant for you guys is we are the authors and implementers and reviewers and caretakers of the federal strategic plan to prevent and end homelessness, also known as All In, which is very exciting this year because of the NOFO. There is an actual call out for All In the NOFO, and it's really an exciting time to have that alignment with the federal strategic plan and the NOFO to really have them sort of be linked together and hopefully help communities as they think through what they're going to do as they complete their NOFO applications. If I can get the next slide, please. Thank you. Just to do a really quick recap, these are the pillars of the All-In Federal Strategic Plan. So you know there's 6 pillars: housing and supports, crisis response prevention, equity, data and evidence, and collaboration. And I think if you look at the priority areas that Steve just kind of went through, I think there's an easy way to make a line between a lot of those priority areas and what is included in our federal strategic plan pillars. So what I like to say is if someone's giving you the plan, it's always helpful to go back and look at it and think about how your community application is relevant to that. So we would very much encourage everyone to take another quick look at the federal strategic plan. We know you're in the throes of working in your community to figure out what your priorities are going to be, but the plan can be a really good guide. And I say this on behalf of the folks here at USICH. There are quite a few of us who have been in your shoes and worked on past NOFOs. So we are here to be of assistance to you in any way that we can in support of this work. I also want to say to folks again, as you look through the plan, take the 2 years to really sort of figure out how you are living up and implementing the things that are included in the plan. And I think that is sort of the top line recommendation that we would sort of probably want to share. And I think also really being focused on lifting up the voices and centering the voices and what people have lived experience and your planning and your decision-making process. I think that is one of the things that we all really are trying to think through and expand, but this is a really great time to invest that energy in that effort. And we'd like to really encourage communities as they work together to develop their applications over the next few weeks to think through that. If I can get the next slide, please. One of the things we wanted to do as we were sort of thinking about how to support in this conversation is to really kind of highlight a couple of things from our website on the USICH website that are publications or resources that we think really support the NOFO in key areas. This is not an exhaustive list, but we wanted to give you guys a couple of quick hits of things that we thought were important based on the review of the NOFO and priority areas. So you'll see here, there's a heavy emphasis in the NOFO on talking about connections with healthcare systems. And we have a couple of guides that we have here. There's one on health and health hospital systems and addressing homelessness, but there's also a couple of community spotlights. What I like about our community spotlights is they give examples of real people in real communities that can tell you how they've done some of the things that they've done around specific areas. So I always think if you want to know a great example of something, find someone who's done it, talk to them and try to figure out if you can replicate or what elements of it will help your system to improve your actual operations. Additionally, there's the 19 strategies document that's recently been released around addressing encampments in a humane and effective manner. And really, this is really focused on giving communities a starting point to think about solutions that are actually very tactical and tangible about addressing homelessness and in a way that does not criminalize or further expose people who are experiencing homelessness to criminal activity. So I like to call that out as people are thinking about resources to think about what they can use or draw upon as they think about local plans and what to prioritize in their community. One here that I wanted to sort of also point out is our older populations document. It's a document we did in partnership with the area agencies on aging to really offer a resource for how people can address the needs of older adults. We know that communities are hopefully looking at their data and finding out what their primary special population of interest should be. But this is a great resource to sort of show you some real tangible examples from communities around addressing the needs of older adults who are experiencing homelessness, and hopefully to give you some solutions as you think through your panic process. Also, the last resource I want to lift up is this one here. It's our annual report. And I always like to remind people of this report because I remember when I was doing the application years ago, there's always this section where we're asking people about connections to mainstream resources and other resources, and really reminding people that there are existing federal programs that are available that are addressing the needs of people who are experiencing homelessness. And this annual report is a little bit of a catalog of those. And I always like to invite people to go back and look at them. I think it's a great conversation starter in your community that can help really support conversations around collaboration and coordination. If there are partners that are engaged in supporting these activities and you do not know them, they're great people to involve in your work. So I like to also point this out. And last, but absolutely not least, I want to lift up the resource of our senior regional advisors. Our advisors are there to be a support. They are in communities. They have worked in communities before. They know of communities that really can be able to be a resource to you as you develop your plans or as you move forward. And I'd really like to ask you if you have any support and concerns, that if you want to reach out to them, they're there to support you. I wanted to go ahead and wrap up at this point. I appreciate the time. And Mary, I'll turn it back over to you. Thank you so much for this opportunity again.
Thank you, Erica. But before I pass it back over to Kay, or pass it over to Kay, there's actually one question that I'd like for you to answer live. There's a question in the Q&A that asks if there is funding for those that are part of the All Inside unsheltered initiative. If you could just provide clarity, that would be great.
No, there's no additional set aside, I don't think, in the NOFO that's related to that. So no, there's not anything special for that. But for folks who don't know, the All Inside initiative is supporting very specific communities across the country with having some embedded federal staff that is supporting that work. And if you're interested in learning more about that, there's definitely information on our website that you can find the communities. And a lot of those communities have done a lot of interesting work around administrative and rule changes. It's a little bit wonky, but from the federal space, incredibly exciting and streamlining a lot of processes. So we can also be a resource to our senior regional advisors to find out if some of those things those communities have done. Does that answer the question, Mary? Thank you so much.
So I think Mary Frances is talking, but her mic is muted.
Somebody accidentally muted me. Thank you, Kay. You need no introduction. I have you on there as Kay Mosier McHousing, which I love that for you. I'm going to turn it over to you.
Thank you. So I'm going to talk. So echoing what Erica said, and by the way, Erica formerly worked in Virginia, and it was actually the community she worked in that I learned some of the folks there used to call me Kay Mosier McHousing, and somehow that got sent to Mary Frances, and so here we are calling me that. But I think what I used to write the NOFO, it was just so helpful. I mean, there's so much, right? And you have to really think about it. And sometimes I would get hung up on like just thinking about the NOFO and not thinking about my actual continuum, what my community looked like, what I needed to do. And so as I started to learn more and do more, I just learned about how important it was to be strategic and to think about this as a year-long planning process. This is not something that you wait until the NOFO drops and then start thinking, okay, what do we do now? But rather, if you're doing this all year long, you'll have a much better sense of where you need to go in, within the realms of the NOFO. So next slide. So be strategic, right? That's what we want you to do. So this is what, when we think of the funding that we get, the whole goal of everything we do is to either divert people from imminent homelessness by helping them find alternatives to homelessness, safe alternatives, and when folks do end up in the homeless system, that we can rehouse them as quickly as possible. So everything we do should be, are these going to help us reach the goal? If we fund this, is it going to help our community get to this goal? Next slide. Okay, so here's your end game, right? And we've heard this phrase a lot. Homelessness is rare, right? So that's what we talked about, the diversion. Like we want to try to keep as many folks in housing as we can and not have them end up hitting the streets or shelter. If they do hit the streets or shelter, we want it to be brief. And when they do leave the system into housing, the goal is for it to be one time and not just an in and out and in and out. So on the housing side, these 4 things are the kinds of things I want you all to be really thinking about is like, do people in a housing crisis have access for a place to go, right? What does unsheltered look like? What are our lines of homelessness look like? And are people exiting homeless quickly and not cycling back into homelessness? And I'm going to talk about this in a minute, but HUD, and Steve has already talked about that. HUD in the last couple of years they gave us a lot of warnings, that might be the word, or nudges that we're going to start really focusing on housing. And then 2 years ago they did. And so your outcomes, what is happening in your community really, really makes a difference. So these are the kinds of things you want to look at. And you have data about this. So you heard about the data. We talked about that. I'll talk about it in a minute. But when you look at these kinds of things, you should be on a regular basis thinking about this. Is what we're funding helping us reach these goals? Do the current projects we have house people quickly? Do people that exit stay housed? And really be thinking about that, because even if it's a legitimate project, if it's not meeting the goals of the end game, then how do we need to rethink that? Next slide. So here's your performance measures. And and I think, you know, there's data in throughout this. What I do sometimes is I talk ahead of where my slide is, but these are the main goals, is that we want to reduce the inflow into homelessness. I talked about that. We want to increase the access to permanent housing. We want to decrease the average length of homelessness and decrease returns to homelessness. And so when you do your system performance measures, your SPIs, right? Your SPMs, that data is already in, right? HUD looks at that. You need to be looking at that. So one of the things to get started on is literally take a look before you even start writing your NOFO, is what have these measurements looked like over the last couple of years? What have we seen? Are we seeing trends upward in a negative way, or upward in a positive way? Same thing, downward in a negative way or downward in a positive way. Have our access to permanent housing been going up, which is a good thing, or have they been coming down? Has the length of stay been going up, or is it coming down or staying the same? And then be able to talk about whatever projects you're funding, whatever plans you're doing. Are we addressing these? Are we being very proactive and thinking about all the programs we're funding are aligning with these goals? Next slide. And so here's your system interventions. And of course, the NOFO in itself does not fund every one of these system interventions, but these are the interventions you need in your system. And in your NOFO, in the writing of your NOFO, you want to look at each of these interventions and be able to also not talk just about like what HUD is funding, but when you answer the questions and you're really being strategic about it, you need to have a real awareness of what's happening within all of these interventions. What does it look like? How is it working? And be able to, even if things in your data is not showing you where you want to go, address that in your answers, because it shows that you are making strategic moves. Yes, we know that this has been happening, but that's why we're asking for this funding, or, you know, this has been happening, but this is why we're going to reallocate this, or this is happening, but we have plans to look at other sources of funding to make a difference about this. So be aware of all of these things, how it's impacting your outcomes, your system measures, and what you're planning to do if there is an issue anywhere. Next slide. Oh, there you go. Forgot the little star that came in. So again, back to what Steve said, housing first. All of this is within that housing first concept, data driven. So you don't just talk, you know, we can talk. Somebody said to me, can you tell me a really good writer to help us write our NOFO? Because we have not been scoring well. And my response was, you could get the best writer in the world, but it's not how well someone writes. It is your stuff based on housing first? Is it data driven? Is it, you know, does it show equity, and is it coordinated across your system? Because the best writer can't change what your data shows and what your output shows. So it's very important to remember, it's not exactly the person that writes, and obviously a good writer is good, but it really is much more about your performance, and HUD has made that very clear in recent years. Next slide. So you want to increase system flow. I live in Florida. We have a ton of these traffic circles down here. And what you want to be looking at is our system in the traffic, say you're in this traffic circle, and what you want is that everybody has a role to play. Like, you have to understand how the system flows. You need to understand, if you know, how you enter the circle, what lane you need to be in, how to go out. And as long as people understand the rules and are working together, that traffic circle works really, really well. But because I'm in Florida, there's a certain months of the year where we have a huge influx of people who have maybe never been in a traffic circle and are hugely intimidated by them, and they get to it and they stop dead, or they just pull in without waiting where they need to pull in and watching it. And what does it do? Like, just one car, one program can completely get in the middle and just mess up that entire system flow, that entire traffic circle. So really be looking at not just your, you know, each individual program, but also, how is this working as a system? Are we having the flow we're looking for? And the next slide's also another way of looking at this. And so we'll get to the next slide, do the first click. So what we've learned, and a lot of times when we're in communities, working with communities, we look at, what are you funding? Where are you funding? And it sort of looks like this on the left, is that there's a lot of investments. It's like, oh, well, we need permanent housing. And so, we might end up having tons of permanent housing for families because that's what everybody decided we wanted. But what we look at is that what you need is a lot more interventions for singles because you have a lot more single individuals than you do families. And so you end up sort of having a mess because you have a lot more single unsheltered folks because you haven't invested wisely. Even though permanent housing is always a good thing, you have to be very thoughtful, right? And strategic about what you do. There's that thing out there, very mindful, very demure. I don't know if it's demure, but be really mindful in what you do because, next slide, or click again. Oh, next, back. So if you click on that, you can make it move there. That's what we want your system to look like. And when you're strategic and you're mindful about what we're funding, and just because something's been funded for years and years, if it's not adding to the system flow, if it's backing up the system, if it's not strategically needed, really be thinking about reallocation. If you have a program that's not spending all of the dollars that need to be, that they have, and they're sending them back, really look at, can we carve off that amount of money and start another project? So everything you do needs to be strategic. Next slide. All right, so here's your steps. Reflect. And I just talked about some of the stuff you want to be reflecting on. Review, that's looking at your data, looking at your last report that you have, your last NOFO that you sent in, looking at the debrief that they sent you. Where did you get points? Where did you not get points? And then finally reading up, like reading the details. And so now I have a couple slides in each one to dig a little deeper. All right, so look at your data and really pull your data. And yes, okay, let me stop. Data is so important. And when I hear, or when it feels like communities, get their data, they get their point in time count, they get their hits, they do their system performance measures, and, they report it out to the larger continuum. And then it's sort of like, it's just a report. But every time you look at your reports and your data, do an analysis of them. Really be thinking about, does our data show what we need to do? And you also then want to use lived expertise and equity as the foundation as well to make sure that you've got the right kind of crisis housing, right? Having tons of shelter beds is not going to make a difference if they aren't meeting the needs of the folks that need them. So you look at your unsheltered folks. You look at the likes of time homeless. I talked about this before, but now I want you to think about pulling up your data and what's going to tell you this, and people exiting homelessness quickly. And I think you do it once a year, but I really encourage you to pull this stuff at least quarterly. Once a year is not enough. So your quantitative data is going to tell you what's working or not, but also qualitative data. That's your surveys. That's your focus groups. So you've got the data, the numbers, but you also need to be listening to what folks tell you. And as you write your NOFA and address the different areas and questions in it, be ready to talk about how you come to the decisions, both using quantitative and qualitative data. Next slide. And so making sure that these are the things, Steve went over these things. So you've got it on this slide and you had it on his slide. So pull these slides out. And as you're looking at your NOFO, as you're thinking about answering it, as you're writing it, keep reflecting back. Are we doing this? Are we showing not just that we have a person that sits on a committee, but more, how are we actively including people with lived expertise in making the decisions we make and helping us decide what to do? How are we specifically, not we know about our racial disparities, but what are we doing to change it? How are we reducing inflow into homelessness? How are we doing all of this? It's so important that you're really thinking about all of that. All right, next slide. And by the way, there's a lot of words in these slides because we know that after the webinar, we hope you take the time to really go through these slides a little bit more carefully. If you can't, throwing out a lot of information now. So this is being strategic now, right? Reading and understanding the NOFO. So this is everybody in your continuum of care should really understand the priorities. You start there. And I find that, even my own experience, we tended to just sort of shoot from the hip or, have these alliances and partnerships with people. And we work more from an emotional state sometimes than really using our data to make the decisions. So people have to understand that this is not business as usual. What we did 10 years ago is not what's going to help. And if we have not been getting increases of funding, if we've not been getting new programs coming in, if we've lost some of our tier 2 programs, then making sure that you really understand and are looking at it and that everybody knows that. And your whole system should know those priorities. And this is where, again, the data, and now you sit down and strategically, and this is your governance board, some of your committees should be really looking at and say, where are there gaps? What lines up and what doesn't line up? One of the things I'm going to, that I tend to look at is, okay, again, I talked about the PSH, but also like rapid rehousing or even if we're doing some joint components, what populations are we serving? Because HUD's looking at your point in time count. Who do you have? Who are the unsheltered people? Who are the people that are in shelters? And then what are the different interventions you have? And so, if 35% of your folks are people and families and 65% are singles, and yet 80% of your funding is going to family programs and only 20 to singles programs, there's a mismatch there. So if there's an explanation for that, be sure to talk about it. But if not, be really strategic in thinking about how you do that. And also, I already talked about this, but I said it last year and I said it the year before. And I hope some of you are here that heard us say that, is that don't wait till the NOFO comes out when you want to look at reallocation. You should be evaluating programs. You should be looking at the history over the last several years, of what's happening. Just because it's an eligible project, even if it's a project that that has decent outcomes, if you have 2 rapid rehousing projects, for example, and each one gets $250,000. And one project is housing and successful, like with, 400 clients with the same amount of money that another project is serving 50 clients with, you need to step back and say, could this other program either learn from the program that's doing a much better job and much more successful, or do we need to reallocate dollars and increase the services of the program that's serving a lot more people? So be strategic in that. Next slide. There we go. And then the detailed instructions. A big issue, and I know a lot of you do have folks that help you write your NOFOs, and usually those folks that are used to doing it know this already. But for a lot of us, we didn't have the resources to hire somebody to do it, so we did it internally. And big lesson learned for me, and read the detailed instructions and read the questions. Look at the questions and then go to the detailed instructions, what goes into detail, what they're looking for, and make sure that you are answering exactly what it says in the detailed instructions they want to hear. Too often, there's like these sort of vague, sort of answering the questions, but not within the detail. And so making sure that it's a good fit with that. The other thing is, for those of you that are getting your YHDP renewed, you need to really pay close attention to the renewal and replacement instructions, because it's going to be very different from your initial application. And then say there's a question, but in the detailed instructions, it says we want you to answer A, B, C, and D. Make sure you are clearly responding to all of them. Even if you say, even if your response is that, yeah, this has been a struggle for us. But we're aware this is happening and we're really looking, and here's how we're going to address that. So I want to just say quickly, I saw something come up in the Q&A about, we're concerned about our point in time count, because HUD just takes our point in time count information, and our unsheltered numbers have been going up. And so we're just going to lose 15 points there. And so reality is that HUD is not looking just at the number. They want to make sure that you've done a thorough coverage. And if you've done a thorough coverage, you've done what you need to do, that you have authentic and valid data. That's the first part. And then addressing that we are aware of this. And because of this, this is why we are asking, for this. This is why we're funding this. This is how we're trying to address that. You have to have a plan. If HUD's getting a point in time count and the numbers are just going up and there's nothing in the NOFO about what the community is doing to address it, you will lose a lot of points. But if it's clear of what you're doing to address it, and that even the projects you're funding are aligning with how you're addressing it, then you're going to score much better. Again, remember your HDX data, which is already submitted, is what they're looking at. So you don't have the opportunity to go in and put your own data in or some other data element. So what you need to do is look at your fiscal year 24 HDX competition report, pull all of that up, because that is the information that HUD and the reviewers are going to see. And so making sure that everything you're talking about is in alignment with what is happening and what is already known according to your data. Next slide. Slides are moving slowly. All right. So I guess I'm turning this over to Mary Frances. I did not realize that was my last slide, but it's back to Mary Frances. Thank you all. Good luck.
Thank you, Kay. And thank you for adding that bit of clarification. I don't think I did it justice with my response in the Q&A, but I'm going to talk about it in this next section. And I know we're getting a lot of questions very specific to this NOFO. We're actually trying to do something a little bit different outside of what Kay just covered. This year, we really want communities to spend less time focusing on the NOFO. As someone who has written a NOFO before, multiple NOFOs, COC program, mainstream voucher applications, I get it. I understand the stress that collaborative applicants have, that folks that are on the program side waiting to see, where they fall on that tier 1, tier 2 spectrum, have a lot of legitimate anxiety about the NOFO when it comes up. But it's here now. Let's talk about this year off and what we can do. So there's an elephant in the room, and Steve touched on this a little bit. Kay also touched on it a little bit, but I am going to spend just a little bit of time talking about Housing First and why this is so important, not just to this 2-year NOFO, but also for the NOFO year off. There's, the COC program NOFO is a points game. The goal is to maximize the points in the written application, but actually practice what you're writing in that application in real time throughout the year. And if there's a mismatch, that's where you're going to see scores impacted by your system performance, of which the point in time count is used to measure different areas of it, but also your system performance measures. So let's talk about it. And I stole this lovely slide from my good colleague at Housing Innovation, Suzanne Wagner, where she did a session at our conference this past July. And this is just a great rundown of Housing First principles. And I'll tell you why I'm talking about Housing First in just a moment. But in a nutshell, making sure people have quick and immediate access to housing, plus the supports and services that they need so that they can stabilize their tenancy. If you're having Housing First conversations in your community, and the framing of the conversation excludes services and supports, that's not Housing First. It's Housing First, not housing only. I'm sure many of you have heard that before. Housing isn't contingent on any preconditions or compliance with services. And again, you're going to see and hear me say that throughout the rest of today. Housing First is both housing and services. And again, services are voluntary. You can't mandate services, but that doesn't get providers off of the hook in offering services. What we call assertive engagement. continuing to offer services, continuing to offer connections to mainstream resources and benefits, continuing to reach out, continuing to build a rapport. That is a really critical aspect of having an effective housing first approach and in really embracing that philosophy. Last but not least, the services are just provided to help people be a good tenant and maintain whatever their lease obligations are, or shelter rules if we're talking about like a low barrier housing focused emergency shelters. So in a nutshell, from a housing perspective, tenants just have to comply with the standard lease agreement, and they're provided with the services and supports that are necessary to help them follow that lease and maintain their housing. So when we are talking about housing plus services, why are we doing this? Well, first, the Alliance has three sort of main arms in the work that we do. One of those arms is situated in research and evidence. So there's a ton of research and evidence over decades that says that this approach works. And ultimately, it recognizes two key points, which is that people are most successful in addressing other issues when they're in housing. And those other issues could be anything related to like childcare, family reunification, substance use disorders, mental health challenges, physical health challenges. The research and evidence say that people do better when they have a really safe and stable place to call home. Also, the second point there is that people really thrive when they have autonomy of choice and respect and are not coerced into services without their consent. So again, for folks that may have joined after we announced that the materials will be made available on our website shortly after today's webinar, just want to note that again, this information is up on our website as well. So this approach, Housing First, works best when communities build and preserve enough affordable, accessible, and safe housing. I'm seeing that come up a lot in the Q&A today. And I think there was even a question about when HUD would invest billions of dollars in affordable housing and why is affordable housing defined the way that it is. It absolutely is lacking some clarity, I think, from an alliance perspective. When we are talking about affordable housing and we're advocating for affordable housing with our national partners or federal partners, we are actually talking about the type of affordable housing that people who fall in that extremely low income bracket. So the 0 to 15%, folks that have no income or barely any income at all. We know that Housing First works as an approach when programs are fully funded. Thanks to some of you on today's call who've been advocating with us. We put out a workforce study earlier this year after administering a large survey to the field in which over 5,000 people responded to the survey. And we advocated alongside each of you for a cost of living increase. Is it enough? Of course, it's not enough yet with inflation, but your voice matters, your advocacy matters. We do try to listen to what the field tells us and amplify those challenges that come up. And we have to keep advocating to ensure that programs are fully funded and can employ and retain enough staff to serve clients. And last but not least, Housing First works best when clients can opt into what's available, not just what's available, but what's adequate for them and what meets their individual needs. So you might be asking, why am I talking about Housing First? I am talking about Housing First because this is a core activity that communities should be doing in their NOFO year off if they are not already doing so. Looking at program fidelity to Housing First, and I'm going to tell you why. If you are using a Housing First approach and philosophy across your system, so that means emergency shelter, rapid rehousing, supportive housing, you're having a housing focused street outreach program, the entire continuum of services. If you're not maintaining program fidelity to Housing First, it is likely going to be demonstrated in your outcomes, both from the lens of system performance measures and also your point in time and housing inventory count. Those things put together matter in terms of your COC program NOFO. But if I'm really being honest with you all, which I want to be honest with you all today, the amount of funding for the COC program is pretty limited. There are not going to be a ton of communities that gain the volume of funding needed through this competition to end homelessness. So you've got to be smart, you've got to be strategic, and you have to look beyond the NOFO itself. Really focusing on your system performance will allow for you to leverage other funding sources in addition to the COC program, which of course is one of the larger programs, but there are dozens of types of funding streams that are out there and related to homelessness, but also many of you today are probably from the nonprofit sector and have the opportunity to apply for other funding opportunities. The outcomes that are achieved through your programs or through your system can really influence your ability to leverage other funding opportunities. So this is a great activity to do in the NOFO year off. This is a HUD Housing First Standards assessment tool that you can use. It is available on the HUD Exchange, and it will help guide you through the instructions on how to go through this process so that you can have an understanding of how your providers are doing and how your overall system is doing. So nitty-gritty of NOFO year offs. And forgive me for those of you who might have been at our July conference where myself and Norm Suchar had an opportunity to co-present together about this very topic. This is a repeat, but it was so important that I felt the need to repeat it on a webinar for a broader audience than those that were able to attend our conference. So for COC leadership, folks that are on a leadership board or executive committee or in the role of writing your collaborative application and leading your local process, kind of just alluded to this, but your entire COC universe should not revolve around the NOFO announcement. If you're not already talking about recalibrating your system to be more effective, efficient, and equitable, now is the time to start because you will have a year off. HUD is a funder, and a pretty large funder. You have to use the signals that they give to improve your system. If every year for the last 5 to 6 years, or really decade, I can say, they've been talking about housing first, they've been talking about racial equity, they've been talking about lived experience, that came on closer to like 2018. You have to pay attention because they, as a funder, have a right to determine what their funding priorities are, the same way that philanthropy determines its funding priorities. So pay attention to those policy priorities that Steve talked about, because you're going to use that information to determine what your community has, what is working, what is not working, and where you need to fill the gaps. Some other activities that COC leadership can be doing: conducting annual monitoring and evaluation of projects. And this is not something to be punitive. This is really to help support any sort of corrective action before the field office or state or other funders coming in, but also so you all can understand how your programs are in service of preventing or ending homelessness. And again, not a punitive approach. Monitoring and evaluation is so that you all as COC leadership can be the local technical assistance providers to help them improve their performance and help them improve how they operate their programs. Which leads me to the next point. Making sure that you're providing ongoing training for the overall system is really critical. COC leadership, you all are the local TA providers. as you are thinking about training, this is one recommendation that I generally have for all communities. Make sure you have an annual training plan. Training is not a one and done type of deal where you've completed the training and then people can go be great and know how to be trauma informed providers, or understand what fidelity to housing first looks like, or know what it means to have equal access in emergency shelters, or any of the other range of training topics that you can think of. So it's really important that there are ongoing opportunities for training, especially with the turnover that we've had. So if you don't have an annual training plan as a COC, think about adopting one, and think about creating those ongoing learning opportunities for people to understand. I won't drive this in too much because Kay really focused on this in her section about being strategic, but really talking about system and project performance, reviewing that data. Data should be reviewed on a monthly, quarterly, and annual basis. There should be some sort of performance and evaluation committee within your COC, or a data and evaluation committee that is constantly talking about data, benchmark, making sure that you have benchmarks across the different types of programs, so that your project performance is actually reflected in the systemic performance. So you want to look at your data by project, but you also want to look at it at the systemic level, because this is this is an interconnected effort within the COC. And if one of those projects are off, it can throw the whole COC system-wide performance. Kay also mentioned this earlier. Reallocation sometimes is a scary topic to broach, especially if you have service providers that have been in the community for 20, 30, 40, 50 years or so. But it's necessary, and it doesn't have to be scary. We don't have to be afraid of having these conversations. Conflict can be healthy and when you are transparent. Develop a strategy as a continuum of care so that there are no surprises. Talk about voluntary reallocation, but also involuntary reallocation. What does it mean? How do you get to the point of involuntary reallocation? Well, after that monitoring and evaluation and attempts at corrective action, if there aren't any changes year over year, you might need to have that conversation with a consistently poor performing project. And I'll use me as an example. I've been at an organization that made a decision to voluntarily reallocate. They said, hey, we don't want to do this type of project anymore. And they were able to reduce some of their funding, which put it back into the bigger pot so that other projects within the COC could tap into. So it's really a win-win opportunity to both identify folks that are like, I'm not dealing with HUD and their FMR stuff anymore. I want to do something different. Here's the money back. Let's let another operator step in and give it a shot. But on the flip side, you can also and should also be having conversations about providers and projects that are just not meeting those benchmarks and standards that you've established as a COC. Last but not least, when frontline staff and people with lived experience are telling you what's wrong in the system, please believe them and please act on it. I think it's been a journey for COCs that are integrating or working towards integrating people with lived experience or expertise of homelessness. So often we find in communities that the feedback is there, it's just not being acted upon. So just wanted to stress that having them at the table is not just, it's just not enough. You have to actually believe what they're saying, because those are the ones that are closest to your system. From that lens of lived experience, they've navigated it, they understand where the challenges are, and you have an opportunity to do some course correction on those challenges. So some of you today might not be in a COC leadership role, or you might wear two hats. So what about program managers? So I think that program managers should be actively in conversations about the entire system. If they're discussed at a board or a committee or subcommittee or work group, make sure your organization is a part of these discussions. So not just so that your perspective and voice is represented in conversations about the system, but also so you can create opportunities for frontline staff. Personally speaking, and I've worked in many different roles over the last 17, almost 18 years, someone gave me the opportunity to participate on a subcommittee and a committee, and that just opened my eyes from the lens of a direct service provider working on one piece of the puzzle to an entire system. And it's really important that we're creating leadership opportunities that are systemic in nature for frontline staff. The next piece, I won't spend too much time on this, but knowing those HUD priorities. Next piece, program managers, make sure that staff have enough time to be able to attend trainings. But also, as a program manager, it's your responsibility to create learning reinforcement activities so that they can actually apply what they're learning in real time. So I'm going to go back to trauma-informed care. If people are going to a trauma-informed care training, what does it even look like to create learning reinforcement activities? Well, you might do that through the lens of their case notes. How are their case notes looking? Are their case notes speaking to strengths? Does it demonstrate assertive engagement, cultural responsiveness, and humility? And then have a conversation with them. Like, that's just a quick example of how you can create learning reinforcement activities just to kind of see how they're applying the learnings in real time. You could also create a survey for, case managers so that you can understand the people that are being served in the program, what their experience is like. Another one, this is already a requirement, but oftentimes it's more of a check in the box exercise, but program managers play a really critical role when you have relationships that span either within the homeless response system or external to the homeless response system. You want to be helping your COC identify new members and organizations. We cannot end homelessness in a silo. We need those partnerships, and we've got to look outside of ourselves. If we had the answers within our COC structure and our current COC configuration, we would have already ended homelessness. We absolutely need some of those external partners that are working in the child welfare system or the criminal legal system, the education system. If they are not actively members in your COC structure, please consider helping your collaborative applicants and folks that are responsible for facilitating COC governance structure, help them identify new members and organizations to join your COC, because we really want to see continuums grow and also break down some of those silos. Talked about this ad nauseum a little bit in the previous slide, but voluntary reallocation. If a program isn't aligned with your organizational mission, you've got a new strategic plan, you're going in a different direction, or for example, you just don't feel confident in being able to spend down a grant year over year, raise your hand and say, hey, for the greater good of the COC, we want to voluntarily reallocate. Who else can step up and step into this program? Or do we just need, as a system, not to have this program anymore because it doesn't meet our current landscape or needs? Those are really excellent conversations to have and think about as a program manager, even though it can be terrifying to think about giving up funding. Last but not least, focus on your project-specific qualitative and quantitative data. HUD has conditioned us to think in terms of numbers, but behind those numbers are actual humans, and their stories really matter. Their stories are really critical to help us understand and contextualize the numeric or quantitative data that we have. So for example, if your PSH has not had anyone move on in 5 years, you might want to start thinking about engaging in conversations about moving on, particularly for those who are no longer in need of supportive services. Might they want to transfer to a long-term subsidy? Can you broach that conversation with them? And can you support your staff that are providing the direct services to them? If there's a rapid rehousing project taking, a little bit longer from approval to move in, come up with some incremental goals so that you can decrease that length of time from approval to move in, and just re-emphasizing the need to listen to people with lived experience or expertise that are telling you what's wrong with your program. Tying it up together, just wanting to reaffirm that in terms of, whether we're at the project level or the systemic level, there has to be a focus of services on securing and maintaining housing placements, but also increasing income and benefits for people who are experiencing homelessness. You want to implement an outcome and performance-driven approach to achieve those goals. And again, we're not asking for communities to establish benchmarks that are not attainable. You want to take a look at your data, you want to see where you are, and then maybe make a goal that's a 15% increase or decrease over where you were, and put those strategies in place so that you can accomplish that and continue to do that year over year until you've got better outcomes and performance. Make sure that you're using evidence-based practices. This is not an exhaustive list up here on that slide. Motivational interviewing, trauma-informed care, critical time intervention. There's a lot of great resources on that support a housing first approach and philosophy. If you're not already investing in housing problem solving, I strongly 10 out of 10 recommend it, not just from a shelter diversion perspective, but like a rapid exit model, shared housing strategies. Make sure that your community is looking to invest in those strategies that have some really positive outcomes. Gonna say it out loud. Now that the elephant's out the room, please move away from housing readiness and towards a housing first philosophy. HUD, as your funder through the COC program, NOFO, continues to ask communities to do that. And there will continue to be communities that don't do that, and it will be reflected in their scores. That does not mean, again, housing only. That means housing plus supports and services. Preserve the highest interventions for people with the highest needs. So the supportive housing, the special purpose vouchers that have certain conditions around who's eligible for those. Last but not least, you want to transform systems and programs that aren't effective. It is okay to break up with your providers. And conversely, providers, it's okay for you to break up with your continuum of care. That's what I wanted to focus on today. I'm actually going to turn it over to Josh to provide some context on resources. Josh?
All right, thank you so much. Well, I want to stop and just acknowledge all the great knowledge that was shared by Steve, by Kay, by Erica, by MFK, Mary Francis. So many great jewels that was dropped. Excited just to close us out by just talking about some of the resources that can help us move forward. But on the next slide, I'll talk about the, just as the reminder, as we kind of talked about with our housekeeping, we are not HUD. So there's some, I know we're all trying to figure things out. Some of the very, very technical questions that we have around scoring, around, bonus points, we want to maybe ask the COC NOFO at HUD.gov. And then just as a reminder, as, unfortunately, we're seeing more and more an increase with natural disasters, that if it does happen, you do need to send a written notification to COC disaster at HUD.gov during this process. So just that's just a quick reminder. And then just on the next slide, I'll talk a little bit about just some of the reminder of the deadlines. As you know, it was released July 31st, which feels like it was last week, but apparently it was about a month ago. And then we have 30 days prior to submission deadline, all project applications are required to be submitted to the COC. And then 15 days, COC is required to notify all projects, applicants who submitted the projects, and then the COC by the established deadline, whether their project application will be accepted, ranked on the COC priority list, rejected, or reduced by the COC. And then on or before Monday, October 28th, COCs must post on their website, for our partners' website, all parts of the COC consolidated application and notify community members of all of this stuff. So that's on the Monday, October 28th, 2 days prior to submission. And then the submission date is, of course, Wednesday, October 30th, 8 p.m. Eastern Standard Time. So just making sure those dates are noted in your own world, the time frames, and those are just things that we need to abide by. So on the next slide, we'll just talk just briefly about some really great resources that will help with just moving the needle, right? I love how when we talk about this, it is of course talking about the NOFO, of talking about an application process, but we're ultimately talking about serving people better, improving on what we're doing. And if we continue to improve, and as Steve was saying, if we do the great work, if we continue to ensure we're serving the folks the most vulnerable folks in our community effectively, then the NOFO process will be a lot easier. And here are some resources that'll help you with doing that. One, about centering and promoting equity within the work you do, engaging in centering, leveraging, compensating, hiring, retaining people with folks with lived experience and lived expertise as a part of our ongoing work, right? So here, this is not exhaustive, but this is a great starting place. And then on the next slide is we're really going to it's really some great resources highlighting, housing first, right? We talked about housing first. There's a reason why we talk about housing first so much, and why it's ranked so much, because it's evidence-based, right? We know that it works. We've seen it work. And a lot of times when we have conversations across the country about housing first, and there's like pushback, it's usually from a lack of like truly understanding what housing first is and isn't. And I'd encourage you all, as you all are continuing to do the great work you all do in the community and utilize housing first and throughout all systems, to use these resources to, one, educate partners and folks across the system and community, and two, to continue ensuring that we're walking that walk as well. And then ultimately we have some other resources just focus on and thinking about our system improvement resources just to help us move together. Kay, a lot of times in trainings, she talks about, in communities, we have a lot of really good clocks, right? A lot of good things happening. But what does it look like for all those clocks to work together and be actually one big clock? So one big system, and those are the resources that will help get us there. So these are not exhaustive. Of course, there's great. Erica mentioned some really great resources with the All-In plan and some community examples. We also, again, you can go to the Alliance's website to get some additional resources. But these will be really good resources to get us going and move the needle. So I'll pass it to MFK to close us out. It's great conversation today.
Hey, Josh. Just wanted to take a couple of minutes. We know this is like a lunch break time for folks that are on the East Coast, and maybe a snack break time for folks that are in other parts of the country. But thank you so much for joining or watching the recording. Once it gets published, we really appreciate it. This was something that was a little bit different. We didn't spend as much time going through the materials that we have created for this 24-25 COC program NOFO, but that material is on our website. There's points comparison charts. There's our system series that's referenced right on the screen. Please take a look at these materials. We develop them with the goal of helping you all get through your COC program NOFO. And again, if you have any questions, the email for HUD is the COC NOFO email at the beginning of today's time with you all. So thank you so much for joining. Sorry we weren't able to answer all of the questions live, but you can always reach out to us. Thanks so much and have a great day.